We're here in Estonia and I'm talking to Ain Aaviksoo. He's the Deputy Secretary General for e-Services, and I'm asking him about the basics of the e-health systems and the future. So here we have the basics of the e-Estonian healthcare system. How is it funded, the e-health care system?
Our healthcare system is funded from social insurance tax, which everybody who is a salaried person pays. It's a flat rate, 13% to everyone, and that makes that about 50% of Estonian population are contributing to the system.
So it's about 6% of the gross national product.
Yes, there is slight addition from co-payments, altogether like 20% of the total budget. When you buy some medicines and so on, but the big part of that comes from the social insurance tax.
Okay. And how is it organized? Is there multiple insurance companies or one?
There is one single public insurance company which has contractual relationship with all the providers.
So the providers are more, they're decentralized and they are not owned by the state?
No, all our providers operate under private law. They are controlled in most cases by municipalities or state, but they are either limited liability companies or foundations, and they are legally fully independent.
Are they also, can they be profit oriented?
Yes, as I said, the hospitals are limited liability companies. I don't know any, let's say, publicly owned hospital who has taken out dividends to do something else with that. But in principle, yes, they do make profit, but mostly they invest it back into their services.
Okay. How good is the healthcare system of Estonia on all the different lists?
Internationally, it compares very well when it comes to active care and emergency care. Access to medical doctor, especially at the primary care level, which is 50% of our all outpatient visits, you can have in 2-3 days. And also to have a sophisticated cardiac procedures when you have cardiac disease or thrombolysis with a stroke, that is accessible to everyone and at the level with other Western countries. We do have maybe some issues with rehabilitation and long-term care. And that is something that is on the burden of, let's say, families currently.
Yeah. You spend 10 times less money per person than the Dutch, and even though the income is about half, so you spend a lot less on healthcare.
Yes, Estonian healthcare system has been very cost-effective, and it has been praised for that also.
If you talk about all the changes of the healthcare system, I get the impression that the state is very powerful, that it's basically giving the direction and telling where everybody where to go. Is that impression right?
Yes, state has actually two institutions. Ministry of Social Affairs is responsible for politics and policy in healthcare domain. Health Insurance Fund is public, independent public legal entity, meaning that not taking direct orders from the ministry. They are responsible to the parliament, but state and employers and employees are sitting on the supervisory boards and agree the strategic part of spending or how the money that is collected will be used. But all the issues around who has access to insurance, what are the rules between hospitals and primary care physicians, all those are set by the ministry.
Yeah. You say there's a lot of stress in the system. Where is the stress coming from?
Well, the stress is coming from the fact that for the last 4 years, healthcare budget has been flat. And at the same time...
No economic growth, so no growth in budget.
No growth in budget. At the same time, we still have 3 times difference in doctor salaries between Estonia and Finland. We still have new technologies coming to Estonia.
Expensive medicine.
Expensive medicines and increasing demand from aging and also from the working age population because of early detection of diseases.
Okay, so that's the healthcare system. Then if we move on to the e-health services, what kind of e-health services, how is that developed and integrated into the system?
As all healthcare providers are autonomous and independent, all of them make their decisions on their information systems on their own. So for 40 hospitals, of which 20 are with meaningful size, we have 4 different hospital information systems. Then the state has built health information system using the general a secure data exchange layer called X-Road, which then integrates all healthcare providers, private or public, primary care or hospital care, so that they can freely exchange health data.
Yeah, and they have to basically exchange data. Both the patients have to agree to that, and the healthcare providers.
Yes, for patients, the system is opt-out, meaning that the integration is by default mandatory, but patients have right to deny access of the data if they wish so.
Okay, but I mean the data is exchanged, is in the system. The patient can make it hidden for certain doctors or certain moments, but the data is exchanged to the state healthcare system.
Yes, the national
Data system.
Yeah, the National Health Information System stores all the information by default in a secure environment, but patients have right to deny access to that data.
So you have done that now for about 7 years. Everybody works with it. It's not very expensive. It built on the default in encryption road. What are the experience with e-health services, and what kind of positive results come from that?
First, if you have a system that allows you to provide value-adding services to citizens or professionals, in Estonia, they don't ask the question, is it safe? They ask the question, can it be done better so that it's more convenient, and can it be done faster so that the family doctor would immediately be informed if their patient ends up in a hospital. So the debate in Estonia is how to improve the service.
But after 7 years, what are the top 3 experiences?
Okay, our patients are taking more responsibility, especially younger people. They work with the data, they go to the doctor with already pre-prepared information, and they demand that the information will be available for them after the visit and made available to the next doctor. They would go with their problem.
Yeah, that's what they expect.
We have also seen in hospitals that there is an efficiency gain, so that, for instance, doctors who are active users of this integrated data, their performance is 30% better, because they can flexibly choose the time when they work with the patient data. It is not bound to their desk. It is available to them on the mobile solutions. So that's another thing. And third, state has data which is increasingly made using big data approach, so that prediction and risk-based decision making at the policy level, and later on also at the individual doctor level, is what we are actively practicing.
I also saw you had the e-prescriptions, and you introduced it in 2010. How long did you take that to implement that to a high level?
Oh, that's a good question. I already forgot about that, because it feels so natural. It took 9 months from 0 to 80%. Currently, it's 99% of prescriptions that are all digital, thanks to the system that allowed very smooth rollout. And the different stakeholders after that are very happy with the service.
You spend about 1 billion a year on healthcare. That's about 10 times less per person than in the Netherlands. Is it also because of these good health, these digital health system, that things can be efficient?
Yes, the whole e-society in Estonia, and also healthcare, is efficient to be, but thanks to the digital data management that we have. Different calculations have been made, but it's a big contribution to the efficiencies of the system.
Your plans for 2025, what are you going to do next?
Healthcare system should be turned towards value-based service, so that we do have budget constraints. 6% of GDP to healthcare is felt that is too low, but we want to spend that money better, which means that individuals will have precision support using the genetic and other health information, and also the payment from health insurance are more based on outcomes than inputs or processes.
Okay, so those are the two different to do the big changes in the future.
Yes, exactly. Those.
What is your role in this whole system?
I am personally responsible for making the national infrastructure and services available, but also working together with independent service providers that their willingness to collaborate with the state would remain. And then, of course, it wouldn't be possible if there weren't public and political support to that. So organizing the state services and maintaining the trust towards our ambitions.
How many people do you have in your team to do that in the ministry?
In the ministry, our team is relatively small. It's 15, but altogether, the Health and Welfare Information System Agency, it's around 100.
100 people, okay. And what is your background?
I'm trained as a medical doctor and currently doing my PhD in healthcare informatics.
Okay, so you also started to study ICT on top of that?
Yes, I'm bridging the two worlds, the engineers and doctors.
Yeah. And you also went out of the state and became an entrepreneur for a while to see if you could make products?
Yes, I have the experience of working and earning my money as an entrepreneur. I have had several companies and two of them have been successful and more than two have failed, so I've learned that part as well.
Yeah. And how is it then to be an entrepreneur and to be back in the ministry and trying to put this whole system into the next phase?
It took 6 months to lure me back to the public sector, and the opportunity to make this next phase of digital health happening in a country was what finally gave me the signal that this is the opportunity you shouldn't leave.
Yeah, because it's a great opportunity, but if you work for the government, it's not the big money which draws you there.
Well, no, it's not big money, but also Estonia pays its public servants enough so that I'm very satisfied with my life. Thank you.
Okay, thank you for the presentation.